Chapter 28 is growth and development of the school-age child. We're going to talk in this chapter about some of the physiologic, cognitive, moral changes in the school-age child. We'll talk a little bit about peers and schools and their development. Identify some milestones of the school-age child, the role of the nurse in promoting safety. We'll talk about some nutritional requirements, common developmental concerns, and then nursing guidance. There are your Pima course outcomes. Okay, so the school-age child is 6 to 12 years old. And so there's slow growth in this period compared to the infant and the toddler. But their social and developmental growth accelerates and it gets more complex. Their world kind of revolves around teachers and friends and peers, coaches if they're playing sports, media, a little more independence in this age. And so they continue to mature. They move towards that abstract thinking. Peers are important, not quite as important as we get to the adolescent, but peers are important. And so being aware of some of the growth and development milestones is important. They're more into organized sports, and then we talk a little bit about secondary sex characteristics forming in this age. So we talk about the organ maturation. We talk a little bit about the neurologic system. So their brain and skull are growing slowly, but their brain growth is 100% complete by about 10 years old. The respiratory system, so they continue to mature. Their respiratory rate is decreasing. They no longer have that abdominal breathing. And then their sinuses start to develop around 7 years old. So we think about that's the age where they could start having sinus infections. And then adenoids and tonsils are large, and even when they have no infection. And we'll talk a little bit more about that later. Cardiovascular, so their blood pressure increases, heart rate decreases. And then GI system, so they've lost all their primary teeth and they have permanent teeth by then, except for their molars, which sometimes we refer to them as the wisdom teeth. They have fewer GI upsets, and they their calorie needs are a little bit lower than the earlier years. The GU system, so they have a better bladder capacity, and they can go longer times between voiding. Prepubescence is that middle childhood to their 13th birthday. Usually it occurs before puberty, and so the secondary sexual characteristics we talk about is that rapid growth, the development of pubic hair, breasts, things like that, and then musculoskeletal. They have greater coordination, but their muscles are still immature, so they can be injured easily. The immune system, so their immune system has reached adult levels still at about 10. So back to our theory. So in this age group, it's industry versus inferiority as far as Erikson goes. And so they're developing their own sense, but they're also learning how to do things. They are achieving new skills. So the parents, it's their age to identify those competencies and build that self-esteem, promote that mastery level. If you set your expectations too high, then there can be some issues that can affect them later in life. And cognitive, we talk about Piaget, so more of the cognitive development area. So they can, think about things beyond their own little world. They can see things from another point of view. They can remember situations. They can start to classify, and they can think about family trees. They can put those pieces together too. As far as Kohlberg goes, Kohlberg is moral development. And so about 7 to 10, they realize, how to follow rules and the more of the law and order stage. So knowing what to do and what the consequences are. Motor skills are starting to mature more. Those fine and gross motor skills are more mature. So they have more coordination, balance. They can do more skills, and they have high energy levels between ages of 10 and 12, which is the prepubescence area for girls. They still have those high energies, but they're more controlled and focused, and their physical skills are more than adults. The fine motor skills, the myelization of the central nervous system has helped with more better eye coordination, balance, things like that. Sensory, so their vision typically is 20/20, and good vision is really important for physical development, and so vision screenings are done. Things that can be identified is their lazy eye. They have nearsightedness, farsightedness, astigmatisms, and those can all be identified. But typically, their vision is good. Hearing, so again, hearing is from birth. It's adequate. So unless there's some issues, they may need to investigate. Language, so their language expands. Kids who are in bilingual homes will have more refined skills there too. They can start to understand metaphors and will imitate parents. So parental involvement is extremely important also in this age. Temperament, so the way they behave, really can be an indication of home involvement, parent involvement, things like that. Self-esteem, we mentioned self-esteem before. They can have negative or positive qualities, but they strive for that those goals of that industry. Body image, so body image in this age, they're more aware of what's going on. Bullying or peer victimization is evident in this age. Peers modeling themselves after that. To be accepted is one of their important things. Some of their fears are they have a little bit of a fear of the dark and worry about past behaviors. Some of them are fascinated by death and dying. And then a lot of reassurance in this age is important for kids. Peer relationships, again, I talked a little bit about that, how they play an important role, the approval, and then a lot of times it's what peers are doing, they want to be doing also. Establishing more independence and continuing those peer relationships. Teacher and school influence. So school is a way, way where they can have more social relationships. And then also we can see some issues with school, like I said, as far as bullying. Family influence is huge. So this time, sometimes they're questioning their parents. They're, pushing back on rules, regulations, things like that, and getting more into the peer um, age. Some of the cultural influences that have an impact on growth and development could be language, beliefs, values, foods, things like that. And so it's important to recognize those and acknowledge those cultural practices. So growth and development nurse's role, we talk a little bit about knowing the developmental signs for this age, looking for delays, and reporting those. Family plays a huge part in their growth and development, so we can make sure the family is involved. Sometimes families are split, sometimes they're divorced, sometimes single moms, single dads, things like that. So really making sure that they have the resources they need and understand what's going down. We talk a little bit about the interactions with the parents. Listening is really important. Advocacy is always one of the things that we try and be for those patients. So as far as play goes, when you think about this age, we're talking a lot more about cooperative play, which is playing in organized sports. Their coordination is better, so they're playing in team sports, things like that. They also do enjoy some solitary activities, sometimes collecting things. But as you know, active play has really decreased. Screen time is happening, and which lack of physical activity coupled with nutrition can lead to obesity and type 2 diabetes and some cardiac problems. So play is really important. Education, so school attendance, reading, all those are typically the same as in the preschool age, school age. Safety, so the problem with this age is they're becoming more independent. So they have more self-confidence. Sometimes they have a sense of being invincible and nothing's going to happen to them. So that increased independence puts them more at risk for situations such as strangers, unsafe streets, safe habits. You don't have as much control. Car safety, so seatbelt use. Under 13 should sit in the back seat. Pedestrian safety, again, they can see cars and they think that the car can see them. So there's a lot of pedestrian injuries in this age. The helmets, so helmets and right-sized bikes and all the rules about riding in traffic, things like that. Sports safety is one of the big areas too, since they're playing more cooperative sports. There should be some talk about return to play if they have a head injury. And we'll talk a little bit more about that, I believe, in the neuro chapter. Fire safety, so the importance of having a fire safe escape plan at this age. Water safety, we do talk about even if they have swim lessons, they still need to be monitored. And then poisoning too. Sometimes they're taking pills from other people, and so that's really important to talk about. And so one of the HP 2020 goals is to reduce fatal and non-fatal traumatic brain injuries. And so motor vehicle crashes also could be sports injuries. Abuse, unfortunately, we talk about abuse a lot in this course. You can have neglect, physical, sexual, emotional abuse. I think one of the easiest to detect would be your physical abuse. You can see signs and symptoms. Neglect is a little bit more challenging to identify because you can't see something. You're looking more for signs and symptoms of abuse. One of the biggest uh, things for nurses is that we're the advocate. We're a mandated reporter, so we need to identify signs and symptoms and report them. Again, we're reporting signs and symptoms. We're not reporting that someone's been abused or not. We don't have that ability to do that. One of the ways to kind of identify things under 4 years old is the 10-4 rule. So if they have bruises on the torso, ears, or neck, and they're 4 years or younger, that could be a sign of abuse. And when we think about the ears, most injuries to the ears are on the left ear because more people are right-handed and they will grab kids by the top of the ear, and that will cause bruises, and sometimes you can't see that when they have hair. Any bruising anywhere if the baby's not yet pulling up or taking steps is a sign that there could be some abuse going on. One of the physicians I used to work with would say, if they can't cruise, they can't bruise. So if they can't roll over, they can't do anything, how would they get bruises? We talk a lot about, and I have a lecture on abuse, we talk a lot about, does the story match the injury? So if the situation I saw was, I think I may have mentioned it in the infant chapter, is a baby with bilateral femur fractures who was under 6 weeks old. They're not cruising yet. The only way they could get those injuries would be from someone giving them to them. So, but the 10-4 rule is a good thing to remember. Emotional abuse is sometimes harder to ascertain. Sexual abuse, sometimes we have to get the child alone to talk to them, and usually parents don't leave the child alone. But we have to be their advocate. Sometimes you wait till a child's parent leaves the room. We had a kid who was had bilateral wrist burns, so his hands were burned from the wrist down, and they were degloved. So degloved means that the skin is coming off from a burn. And when we talk about abuse, which, like I said, I'll mention it later, is we look for what's called signs of demarcation. So signs of demarcation is a line that shows us that that kid's hand was held in the water. Or we see that in the buttocks if kids are being punished and they're held down into a hot bath water, and they can see signs. If you think about it, if you put your hands under running water and it's hot, you're going to pull your hands back and you'll see splash injuries. But if a child's hands are held there, or their legs or another limb, then you see specific lines of demarcation. So we suspect more abuse. And this boy had it, and the story was that he was washing his hands and the water was too hot. Well, again, does the story match the injury? In this case, no, it didn't match the injury. So when the mother left the room, she went out to get something out of her car. The doctor kind of slipped in, and he said that his mom's boyfriend had done it. So sometimes they're told not to tell, they'll get in worse trouble, things like that. So it's up to us to look for signs and symptoms. And like I said, we'll go further into this abuse in later chapter. Promoting nutrition, so huge in this age group. Increasing their fruits, vegetables, obviously decreasing fats. That's all one of the HP 2020 goals. So childhood obesity leads to adult obesity, leads to problems. So really trying to promote that nutrition. Sometimes kids at this age don't like to eat vegetables and fruits. Sometimes it's whatever the parents eat that they're used to eating. So just promoting that is important so they don't have problems later in life. Sleep, so you can see that their sleep needs are decreasing. Rituals, routines are still important. Sometimes some night terrors. And then teeth, so dental caries, leading cause of disease. Fluoride is important, so people who have unfluoridated water, it's a problem. They need to have some supplemental fluoride. Sealants, caries, untreated decay are all the HB 2020 goals to focus on. And then discipline, like I said, I don't go into huge discipline, but we have to remember that techniques, consistency, and having the right role model has a big impact on that. Erickson, we talk a little bit about industry. That's part of their development. HP 2020 has really wants to decrease television and video games, so screen time. Some of their other concerns are school refusal. So why are they refusing to go to school? Could be the bullying, the peer victimization that's going on. We have problems with latchkey kids. Latchkey kids are staying alone while their parents are at work. And that's probably happening a little bit now because of homeschooling. In the state of Arizona, there's no legal law that says when a child can stay home alone. It's up to the parents. Some states have laws. Some states say 11, 12, but Arizona doesn't. They leave it up to the parents. So it has to, it depends on how mature the child is. Again, it happens because people work, especially nowadays. But so we're seeing more of it. But it's really up to the parent to see. Now, sometimes you'll have kids staying at home that are young, taking care of younger kids. There was a case a couple of years ago where an 8-year-old was home alone with her 3 smaller children, or siblings, sorry, and she was making something on the stove and things caught on fire and she ended up getting burned and she ended up dying from her burns. But she was caring for the younger children. So we do see that sometimes. Stealing, lying, cheating, sometimes it's during the school age where we see some antisocial behavior. Kids that are well-behaved may exhibit some changes in this area. And again, sometimes there's things happening in the home that precipitate things, these type of things. The smaller school age, 6 to 8, they don't really understand ownership or property rights, so they might steal things, but not knowing the consequences. By 9, they should know those. Lying, I was just talking to my neighbor about children lying yesterday. She was saying sometimes they lie about things that that you can find out about. With the cell phones, you can know where people are, where kids are, things like that. And so it does happen in this age. Cheating, it's not really understood until about 7 years old, but they want to win. They want to be the best. They want to, play, when you're playing a board game, they want to win, things like that. So sometimes there's some cheating. Bullying, we talked a little bit about peer victimization. So children who bully the most, they say have low self-esteem, poor grades, poor interpersonal skills. You can see bullying in both boys and girls, but sometimes it's more the boys that show force when bullying. Smoking, alcohol, so kids want to grow up. They want to be like the adults. So parents smoke, they want to smoke. Parents drink, they want to drink. They're very influenced by that. Peer pressure, again, and one of the HP 2020 goals is to reduce the initiation of tobacco in children and adolescents. Okay, that is it.